Hi, I want to talk to you today about the fillings that are in your mouth. I want to talk specifically about dental amalgam, or silver fillings as they're commonly called. A recent national survey done revealed the fact that over 57% of the U.S. population had no idea that mercury was a major component in your dental amalgam fillings. I'm not here to tell you that those fillings are going to give you mercury poisoning or they're going to get heavy metal toxicity, because it's way beyond my license. You got to go to a physician to do that. But I am here to tell you what's in it so that you can make an informed decision about the materials that are going to be in your mouth and what you're going to be exposed to. So I want to start by just going over a statement that the American Dental Association has made. It's on their website. If you want to see the statement for dental amalgam for dental patients, visit the ADA's Healthy Mouth website for information about amalgam and silver-colored fillings. The statement reads, dental amalgam is considered a safe, affordable, durable material that has been used to restore the teeth of more than 100 million Americans. It contains a mixture of metals such as silver, copper, and tin, in addition to mercury, which binds these components into a hard, stable, and safe substance. Dental amalgam has been studied and reviewed extensively and has established a record of safety and effectiveness. The World Dental Federation and the World Health Organization concluded in a 1997 consensus statement, no controlled studies have been published demonstrating systemic adverse effects from amalgam restorations. Another conclusion of the report stated that aside from rare incidents of local side effects of allergic reaction, the small amount of mercury released from amalgam restorations, especially during replacement and removal, has not been shown to cause any adverse effects. So in 1999, a dentist in Shelbyville, Tennessee, Dr. David Barnes, sued the major manufacturer of dental amalgams in the country, Kerr Manufacturing. He started to develop physical symptoms of mercury poisoning, so he sued the manufacturer, claiming that they put he and his staff in harm's way. They started off in the state court and eventually went into the federal court, and after 6 years, he lost the case. Now, he lost the case not because the court felt that amalgam was safe. He lost the case because they felt that Kerr had sent enough warnings with their material so that he should have been aware of what he was dealing with. So Dr. Barnes claimed that he was exposed to mercury in 3 ways. One, when he was putting it in. Second time, when he was taking dental amalgam out. And the third was that it was in the air in the office. So that, if you imagine when you're removing a dental amalgam, it's like when you're sawing wood, there's sawdust in the air. So he was claiming that what they call a particulate, the amalgam particulate, which is like sawdust, was floating in the air and they were breathing it. So he submitted experts to testify against the medical, dental, and health effects of dental amalgam. Typically in these cases in the past, the American Dental Association has ridiculed this science, saying it's not thorough, it's not reliable, it's not valid. In this case, the 6th District Federal Court found that, in fact, those studies were admissible and were reliable and were valid. They accepted them despite Kerr trying to get them thrown out for that reason. The federal court sided with Kerr, citing the fact that it was dangerous. Dental amalgam is 50% mercury and it is hazardous to your health. Dr. Barnes ended up losing the case because the court felt that Kerr had supplied numerous and many advisory warnings about how dangerous and hazardous the material was. These were the following examples the court cited where the material was in blatant letters and very obviously deemed poisonous and hazardous. The jars in which the dental amalgam capsules were sent in bore prominent warning labels. These labels stated in capital letters that the product contained metallic mercury, and it featured an image of a skull and crossbow next to the word poison. On a chart of different hazards, including flammability, reactivity, and health hazards, the labels warned that metallic mercury presents a serious health hazard. These labels also recommend using protective gear such as glasses, gloves, and a face mask when handling amalgams, and warns that ingestion of mercury could cause neurotoxic, nephrotoxic effects, that's kidney, that the inhalation of amalgam could cause bronchiolitis, pneumatitis, and pulmonary edema, which is lung problems, and that even skin contact with mercury could have harmful effects, including redness and irritation to eyes and skin. Furthermore, each jar included an insert with directions and additional warnings. After instructions on how to use the product, the word warning appeared in bold capital letters, followed by the following paragraph about the dangers of and appropriate precautions against mercury mercury exposures. Alloy amalgam contains product containing mercury. Since mercury is a potentially hazardous substance, proper care should be taken to prevent exposure to mercury. These preventable measures include the wearing of gloves, good ventilation, the use of an enclosed amalgamator. An amalgamator is like a mixer. The amalgam comes in a little capsule and you have to shake it up to mix the materials together. Proper disposal of capsules once they have been activated and used. The use of mercury extorting chemicals in the event of a spillage, because infrequently capsules may leak mercury, and as a consequence the above precautionary measures should always be utilized. A third warning that was included was in the material safety data sheets. They're like 8.5, 11 sheets that come with the product. They're regularly updated. The MSDS, or Material Data Safety Sheet, for the dental amalgam capsules described mercury as a hazardous ingredient and stated that chronic mercury poisoning could cause nervous irritability, weakness, tremors, gingivitis, and graying of the lens of the eye. The MSDS also echoed the label's warning that mercury could aggravate kidney disorders or be nephrotoxic. Dr. Barnes retained expert witnesses who testified on Dr. Barnes' behalf concerning the admissibility of Dr. Barnes' scientific and medical testimony on the basis that it was not supported by valid and reliable published science. The trial court ruled that the supporting science was valid and reliable and overruled Kerr's motion. Dr. Barnes argued that the Kerr warning addressed only mercury, not mixed dental amalgam. The Sixth Circuit Court held that the warning sufficiently notified Dr. Barnes that the mixed dental amalgam was dangerous. The court noted the label on each jar of dental amalgam capsules featured not only a skull and crossbone next to the word poison, but also a list of illnesses including bronchiolitis, pneumonitis, pulmonary edema, redness, and irritation to the eyes and skin. Likewise, the court noted the material safety data sheet provided to all dentist buyers warned that chronic mercury exposure could lead to nervous irritability, weakness, tremors, gingivitis, and graying of the lens of the eyes. Further, the court ruled that the other ingredients mixed in amalgam with the mercury, silver, copper, and tin are not claimed by the manufacturer to neutralize the dangers while the dentist is working with the product. So in other words, the statement that we read earlier, right off the American Dental Association's website, that when mixed with these metals it was safe, the trial court said no, that's not true. It is a poison, and mixing it with some other metals doesn't make it less poisonous. So as a consumer, I think it's important that you're aware that dental amalgams contain anywhere from 45 to 55% mercury by weight. If you go to the IAOMT, which is the International Association of Oral Medicine and Toxicology, or my website, floodthedentist.com, there's a video called The Smoking Tooth, which shows the mercury that comes off of a 35-year-old filling, with nothing more than just coffee or hot water. You're exposed to this mercury every time you eat or chew or drink a hot liquid. As a consumer, you have to make a decision of what you want to put in your mouth. I hope this is helpful. And, if you have any questions, you can visit my website, or you can feel free to call and make an appointment. My contact information is listed below, as well as a link to the video at my website.